Hi people, welcome to Healthy Living Global. I'm Health Educator Mike. Alright, you remember we have been discussing about cystosomiasis, snail fever, bilharzia, right? Have different names, even blood flock. Alright, you can ask, why is it called snail fever? It's called snail fever because the egg is shed from the shell of snail. Alright, snail will harbor it and will shed from there and infect fresh water. And at the end of the day, human beings who go to swim in the water, which is teenagers, especially teenagers and children, who go to swim in those areas, or even human beings that take bath, all right, with the infected water can contract that parasite, all right. So, and when it go into the body, it can actually damage things. Cystosomiasis have different types. There is a cystosome mansoni, there is cystosome hematobium, all right, but all of them is being summed up into urogenital cystosomiasis and intestinal cystosomiasis. Intestinal cystosomiasis always show feces with blood, while the urogenital cystosomiasis shows this hematuria, which is urination with blood or blood in urine. So you may ask, how prevalent is this cystosomiasis? It's very common, all right. Statistics shows that 230 million people are having it globally, all right. So it's common in all these tropical and subtropical countries, all these rural areas. So and it's recommended that in all these areas, let there be good way of sanitation, all right. Use a good source of water. If you are taking your bath and don't trust the water, it's good you boil the water before using it, all right. And even the water which you are drinking, let it be safe. And those who are urinating should not urinate close to water sources. I believe by now you are going to do the needful. Each time you see your child or teenagers around you that are having all this painful urination, cold, catarrh, diarrhea, fever, and the rest, especially urination with blood, I believe you are going to do the needful by taking them to the health center so that they will be properly diagnosed. All right, in health center they can use different techniques to check the child. They can use a microscopy, that urine microscopy, or any technique they would like to use, all right, to know if the egg of that parasite is in the urine. So, and at the end of the day, you get it treated. But if you allow it to advance, it can lead to many damages. You see infertility in men, infertility in women, just like I mentioned. Even it can lead to miscarriage, all right. So in fact, it can lead to anemia. It can lead to shortage of blood, because when there is always blood in the urine, the person might have anemia. So do the needful, all right. So cystosomiasis is very common, all right, and you need to take necessary precautions. Thank you.